You may be the chopped liver.
What are you talking about?
That impulsive little social call fits right into the prosecution's profile on you. G. Alonzo Gates, a young, impetuous, unthinking maverick. Impulsive to a fault. Making rash medical judgments, committing indiscriminate acts in surgery.
Hey, come on, my record's clean.
Clean, my friend. Perk up your ears, doctor. August Havemeyer has not been idle. According to my research, you were accused about 2-3 years ago of sexual misconduct.
That was disproved.
Uh-huh. And a little over a year ago, there was the threat of a paternity suit.
That's a phony. Neither one of those cases made it to court. Whose side are you on, anyway?
Just playing the old where there's smoke, there's fire game, which is exactly what the prosecution will do.
Okay, I get it. Just tell me what we're going to do.
All right, Dr. Gates. May I call you Bonzo?
Gonzo.
Gonzo, of course. Gonzo. Without Dr. McIntyre's support, I'll have to put you on the witness stand in your own defense. That means that you'll be cross-examined. Can you handle it?
I can try.
Would you take the witness stand, please? Please. Dr. Gates, when you made the decision to perform this particular operation on Mr. Mitchell, were you absolutely certain you were doing the right thing?
Yes.
And the surgery was successful?
Yes.
No complications?
None.
Why is it that the defendant is now suffering from excruciating abdominal pain?
I don't know. He didn't come back for a follow-up examination.
I'll tell you why. According to his personal physician's report, Mr. Mitchell has developed a mysterious infection. Without his spleen, which you removed, his body is incapable of properly fending off that infection. Now, if this report is true, doctor, do you still maintain you did the right thing?
Yes.
Even though the patient is suffering? Even though his body is ravaged with pain?
I made the right decision. It was the right thing to do. His doctor wasn't in the OR with me. He doesn't know what had to be done.
You saw Mr. Mitchell at his home very recently. You witnessed one of his painful abdominal seizures. Would you say he was faking? A simple yes or no, doctor.
No, I don't think he was faking.
You admit the pain is real. The suffering is real. His body has been racked in agony ever since the day you opened him up. And yet you dare to sit there and claim that you did the right thing? Bonzo, my friend, if you perform that way in court, do you know what you'll be? Chopped liver.
Would you like to have breakfast with a handsome, dashing young resident who's obviously going places?
It sounds wonderful. When you find him, would you introduce him to me?
For this, I work a double shift. What is Dr. Gates doing here at this hour?
I don't know. He just wandered in and said he wanted to check on a few things.
Well, good morning. How are we doing today?
Oh, not bad, not bad. I'd like you to meet my wife, Molly. Molly, this is Dr. Riverside.
My pleasure.
Likewise, I'm sure.
Well, Mr. Stevens, I have taken care of those arrangements we discussed, and I've recommended Dr. Murdoch for your surgery.
Good. Oh, that's good. Before I go into surgery, there are a few things I'd like taken care of.
Few things?
Yes, see, Molly has a couple of minor medical problems, and I thought you'd be just the man to handle them under the same arrangements, that is.
Bunions. I got terrible bunions.
Mrs. Stevens, I don't think...
Stan, you're not going to create any disharmony in a relationship? I mean, especially now that you're so committed.
suppose I could take a look at her problems.
Bunions. On both feet.
You're a true gentleman, Stanley.
Okay. Go.
How are you feeling, Mrs. Burkamp?
A little nervous. Nothing a six-pack of Valium won't take care of. Either you've had a rough night or you've got some bad news for me.
Unfortunately, a little of both.
Well, I'd make a joke about the rough night, but I am a little nervous. Why don't you give me the bad news?
Well, Dr. Hannigan and I put our heads together, examined the evidence, and decided that you have a pretty nasty ulcer.
I was afraid of that. Is it treatable?
Yes. The recommended treatment is surgery. You should have what's called a partial gastrectomy as soon as possible.
Oh, my. Sounds frightening.
Oh, but the good news is you're going to have two terrific surgeons.
It's not really a difficult procedure. The incision is made in the abdominal wall from here to here. And once the abdominal cavity is opened, the stomach is exposed, bearing the intestine.
I think you can spare me the details, Doctor. Why don't you just give me the high points?
I think it's important that you understand all aspects of the procedure.
Is it dangerous?
There are some risks involved, yes.
I'm almost afraid to ask.
In an operation like this, there's the risk of hemorrhage, infection, and allergic reaction to the anesthetic.
Dr. Gates, are you going to be doing the surgery?
I'll be assisting Dr. Hannigan, yes.
Well, then those risks are pretty slim, aren't they?
Still, they have to be considered. Since we're going to be giving you blood transfusions, there's always the outside chance of hepatitis. And, of course, any operation like this is quite a jolt to the body. Some people take longer to recover than others. It's all covered in detail in this consent form.
I'm going to have to think about this. I'll talk it over with my husband tonight.
You need this surgery, Mrs. Bergkamp, and soon.
It's my ulcer. I will decide what I want done with it.
Don't wait too long.
I can't believe you just did that.
Did what?
Scared Mrs. Burkamp to death. Did you have to go into such complete, vivid detail?
I can only handle one malpractice suit at a time.
You wanted to see me?
Oh, Stanley. Hi, Stan. I'd like you to meet my daughter, Karen.
Nice to meet you.
Hi.
Karen has a few minor problems she'd like you to help her with.
Mr. Stevens, enough is enough.
Go ahead, darling. Tell him. That's all right. He's a doctor.
It's my nose.
What's wrong with it?
Deviated septum. I snore a lot.
I can't.
Stan, you can't disappoint the child. I told her you arranged it. And, while you're at it, excuse me, love. How about a little minor electrolysis, huh?
You realize what you're asking?
Is that too much to ask for the welfare of this wonderful hospital?
All right, Stevens, but this is it. The end of the line. Your surgery is scheduled for tomorrow.
Oh, thank you, Dr. Riverside. I'll never forget this.
Neither will I.
Tomorrow we'll bring the dog.
Oh, boy. I just saw Hannigan. He is about to do a frontal lobotomy on you. You scared Mrs. Bergkamp right out of her surgery.
Just gave her the facts.
Oh, come on. There are better ways to present the facts, and you know it.
I did my job. What more do you want?
Maybe you'd rather not do this operation. Maybe you're getting a little gun-shy, hmm?
It's ridiculous.
Look, I know you're upset about the malpractice suit, and I know you're sore at me, but do me a favor, will you? Don't take it out on the patients.
I was just trying to protect myself, and for damn good reason. Nobody else seems to be doing it.